Hi, thanks for watching. I am doing a quick review of The Great Cholesterol Con by Dr. Malcolm Kendrick, and he is a British author. And the basic idea about cholesterol is that if you have high cholesterol, you're going to have a greater incidence of heart disease or heart problems, and eventually death, or even rapidly. And along with this high cholesterol notion, like that high cholesterol is supposedly bad for you, there's also the notion that consuming saturated fat was bad. And I'm going to just try to swiftly get through this book, just bring up several points. The Surgeon General's Office of the USA found after 11 years that the diet heart hypothesis, about fats, that it failed to prove any issues, any problems with health, in particular heart health. Another test, the Women's Health Intervention USA 2006, 48,835 women aged 50 to 79. This was an 8-year study, and it was a randomized interventional controlled clinical study, which is a gold standard, and they found that there was no significance. There lacked to be any impact in coronary heart disease or stroke issues or mortality as a result of using a low-fat diet. So that's an interesting issue. Along with that are some interesting comparisons of heart disease versus consumptions of saturated fat. In these various countries, more Eastern European like Georgia, Tajikistan, Moldova, Croatia, Macedonia, and the Ukraine, there's a significant death rate between 200, 300, and 700 people a year, 700,000 people a year dying, and their fat consumption is about from about 5% to 7.5%. So they kind of have a low saturated fat consumption. And if you compare it to the death rates in Austria, Finland, Belgium, Iceland, Netherlands, Switzerland, and France, death rates are under 100 to under 300,000 a year, and their fat consumption is double. Their fat consumption is about 13 to 15%. So they're taking double the fat, and there's rather than an average of like maybe 400,000 people, it's more like 150,000 people having any health issues or mortality. So that's an interesting graph. So there was a Dr. Yusuf who did what's called the Framingham-Study, or he was a major player at a conference, and there's a discussion of the Framingham-Study where it was quoted, there is a direct association between falling cholesterol levels over the first 14 years of the study, of the Framingham-Study, and mortality over the following 18 years. So basically that's saying falling cholesterol increased death. So a worldwide compilation of this comparison between heart disease in men range in age from 35 to 74 and average cholesterol demonstrates this. So the death rates start up here. So these have the Australian Aborigines have the highest death rates and the lowest cholesterol levels. Now if you go to where there's the highest cholesterol levels, you'll find there's the lowest death rates, Switzerland. There is a European study of cardiology which runs a a major pan-European study called the Eurospire. They look at risks for heart disease across Europe, and they found in a study a couple of years ago that smoking, previous coronary heart disease, and diabetes proved significant predictors of total cardiovascular and coronary heart disease. However, obesity, low education, raised blood pressure, elevated total cholesterol, and low HDL cholesterol were not significantly associated with higher mortality. An argument about cholesterol disease, especially genetically, is that if you have the genetic predisposition, you are more likely to die. However, according to this quote, there is an overestimation of heart disease in I think it's the Framingham-Study, and the quote is, "The risk of early death and premature cardiovascular disease and familial hypercholesterolemia may have been overestimated because previous studies have looked only at patients and families who sought medical attention." The authors traced all members of a Dutch pedigree dating from 1800 to 1989 and calculated their risk of death. They found that many untreated patients had normal lifespans. An interesting point is that when veins and arteries are exposed to identical levels of LDL cholesterol, yet arteries develop arteriosclerosis and veins don't. If you replace an artery with a vein, the vein develops arteriosclerosis. If you replace a vein with an artery, and the artery is protected from arteriosclerosis. So there's something about the position of the arteries within the body or the job they're doing that causes arteriosclerosis to develop. And the conclusion, according to this author, is that it cannot be LDL or oxidized LDL because the factor remains constant throughout the circulatory system. Another interesting notion is that many people with low LDL still have heart disease. So if the notion of cholesterol being the cause of heart disease is to be valid, why is it that one of the questions is then why is it then that they are having coronary heart disease? Also, many comparisons of what we're supposed to like what's a good cholesterol level, what was used for what's called normal low density lipoprotein cholesterol. It's 50 to 70 mg/dl for native hunter-gatherers, healthy human neonates, free-living primates, and other wild mammals. Okay, all of these folks don't develop arteriosclerosis. Now, who are these that we're supposed to live up to, like have similar cholesterol to? That's the baboon, howler monkey, night monkey, horse, boar, peccary, black rhinoceros, and African elephant. Now, if we look at the lifespans of these creatures who have low cholesterol levels and fail to develop arteriosclerosis, a boar lives 4 to 5 years, a baboon lives 30 years, and then you compare it to the adult American who lives about 72 years. So you would think, maybe our higher cholesterol levels, maybe there's something natural about it. Then if you look at the groups that are considered to be primitive hunter-gatherer communities, they range from 36 years to 17 years that their life expectancy is that short at this time. So it doesn't seem to indicate that low cholesterol is going to give them a long life. The Framingham-Study is a highly influential piece of data. However, when the Framingham risk equation using cholesterol levels was applied to British men for 10 years, it was found that 84% of the heart disease occurred in the men classified as low risk, and the 75% of the men classified as high risk using the Framingham risk data were still free of heart disease 10 years later. So it seems the equation is still missing a few important variables, and this is the British Medical Journal, November 29, 2003.